I'm Candy Higley, and I'm here to educate you on type 2 diabetes new diagnosis. I've chosen to educate my patient on the new diagnosis of type 2 diabetes. My target audience is most often middle-aged patients from all cultures who have gained weight, which puts them over the ideal body fat percentage. I feel when a patient is given this diagnosis from the healthcare provider, they can be overwhelmed to have many questions which need to be answered. So I begin by explaining to them that their body is just not responding to insulin and making them insulin resistant, which is causing a high level of glucose or sugar in their bloodstream. Glucose monitoring is very important for your condition. The goal is to keep your blood sugar within normal limits with little fluctuation. You will obtain one of these monitoring devices at the pharmacy along with strips, just like we have used in the hospital, but these have the strips that pop up, and you will, to monitor your blood sugar, you will cleanse your finger with an alcohol pad, and you will use a lancet to puncture the finger and deliver a small amount of blood on the device, on the monitoring device, on the indicator pad. So the normal ranges before meals are 70 to 100 milligrams per deciliter, and I recommend you do this before every meal and at bedtime to figure out just how your ranges are going. And we have a thing here that you record all of these. You record all of these levels to take back to your physician for follow-up appointments, and that is very necessary because modifications may need to be made. Your physician has decided to place you on oral medication at this time because she feels this is confident that it will control your diabetes. Metformin was her chosen medication. This will be taken 500 milligrams 2 times a day, morning and night. The metformin lowers the amount of glucose not only produced by the liver but absorbed by food, and it also modifies your insulin resistance. The side effects can be diarrhea, stomach upset, and gas pains, and these can all be minimized if you take this medication with food. Extremely important if you visit another healthcare provider for other reasons that they are aware you are on this medication, because there are certain procedures that may require contrast iodine, or surgical instances that this medication will need to be discontinued for 48 hours due to the increased strain on your kidneys. If you're successful in keeping your blood sugar under control with metformin, insulin may never be needed. This is why keeping the log is so important. Follow-up appointments as scheduled by your healthcare provider are very important. You have been diagnosed with diabetes, so the goal of the provider is to ensure your blood glucose levels return to the normal ranges. This will include bringing them your monitoring log so they can see how you're responding to the oral medication and decide if they need to change the regimen. If their therapeutic goals are not being met, other options can be explored. Open communication between you and your provider is necessary. Let's talk about diet now. Your body fat percentage has been calculated to be 40%. So you're definitely needing some dietary modification. Losing the extra poundage can significantly decrease your blood sugar levels. Your provider has prescribed a range of 1,800 to 2,000 calorie American Diabetic Association diet, which will assist in this weight reduction. This diet offers you a variety of choices to meet your dietary needs. The focus is to choose carbohydrates with lower glycemic index so the glucose is released over a longer period of time. This plan focuses on vegetables, whole grains, fruits, lean meats, beans, and non-fat dietary products. Our goal is to attain overall healthy diet with high-quality nutrients and limited processed foods. Exercise is an important part of management of diabetes. We recommend a minimum of at least 30 minutes 5 times per week. This can be as simple as walking, working in the yard, or anything that you moving. I really am an advocate of a cheap pedometer. I have here that you can purchase at Walmart or Amazon, such as this one, to keep a track of your daily steps with the goal of reaching 10,000 steps per day. This is equivalent to about 5 miles throughout the day of walking. So I recommend just increasing your daily activity and challenge yourself to reach this goal. Exercise will help with your weight loss, and combined with a proper diet, many patients regulate their blood sugars to the point they no longer need medications. Complications are the last thing I want to discuss briefly, because I do want you to be aware that situations may require medical intervention. By no means I'm trying to scare you with these issues. I just want to provide you with information and explain that most of these complications can be prevented with the medical intervention you have been prescribed. Keeping your blood glucose level within normal limits will prevent these, so I just want you to be aware how important this monitoring is. Along with 2 to 4 times increased stroke rate, you're also at the risk for kidney disease, because as the kidneys lose protein in the urine due to increased workload from their high blood glucose levels. Eye complications such as glaucoma are more prevalent in diabetics, and foot ulcers due to nerve damage can even go unnoticed in diabetics, because the perception of the foot pain is not there. So proper foot care is definitely essential. I'm always available for questions, and if needed, if there's anything else I can tell you that I did not cover. I feel like my patient leaves with a broadened understanding of their disease. Explaining the complications makes me feel like the patient will have an increased compliance to modify their behavioral patterns and follow medical treatment to improve their overall health. I think I give them a comprehensive scope of their new diagnosis and encourage their motivation. Thank you.